Hello, my name is Rebekah Paddy. I'm a naturopath and medical herbalist, and one of the areas that I specialise most in my clinic is pregnancy. I love working in this area. It's a time when a woman's really motivated. She wants to get healthy, and not only for herself but for her baby as well. One of the areas I work a lot in is diet, and there's more and more evidence now showing that a woman's health during her first 3 months of pregnancy, but also preconceptionally, can affect the health of her baby when her baby reaches adulthood. So conditions such as heart disease and diabetes can be avoided if a woman's healthy in her pregnancy. So it's a really motivating factor. It's a great time for me to teach a woman how to eat well, and often what I find is that the way that she eats will then carry on once she becomes a mother, and the baby and the family as a whole will benefit from that healthy eating. I also deal a lot with what's called complications in pregnancy, and a lot of them are very normal. Things such as constipation, heartburn, insomnia, anxiety, morning sickness, and just general feeling exhausted. They're areas that herbal medicine treats very well, and also I deal with supplementation as well. But of course, looking at the woman's diet can be a really beneficial angle to take as well. I use bark flowers in my clinic, which can really help to very subtly shift certain emotions that are happening, and even if that anxiety, for example, is building up, you can find if that's slightly shifted that it can make a complete difference to how the labour turns out as well, because there's less anxiety and the woman's more relaxed. One area that I do deal quite a lot with, because I have a lot of referrals from midwives, is labour, and so around 34 weeks I see a couple, and I would, or the woman and her birth support partner, and I take them through the labour and try and prepare them as best as possible for that. We use a prepartum tonic, which can then help to prepare the woman's body from about 36 weeks to get her ready for going into labour. And one of the, or two things that we've mainly found with this is that it reduces the need for induction, but it also reduces the likelihood of a C-section. I also at this time really try and empower the birth support person, teach him or her acupressure points that they can use during the labour, and also about aromatherapy oils that can be used during the labour as well. So it's a really lovely time to bring the couple together, and so that the birth support person can feel really involved in the labour as well. And I find that is it's a very sacred time, but often traditionally the man's sort of been on the outside, so it's a lovely way to bring him into the labour as well. I very much work holistically, so looking at all angles of the pregnant woman and how she's feeling physically and emotionally. And I find that the relationship that I get with her becomes a really close relationship, and that relationship continues postnatally. I often see the child and also the family as a whole. So for me, I feel very privileged that I get to know the family and get to work with them naturopathically, and it's often a relationship that continues for sometimes many years.